Face masks provide protection against many respiratory infections that spread through the droplet route. Coronavirus is one of them. It can easily spread in the environment when an infected person coughs or sneezes. But there are two possibilities about wearing the face masks. Wearing masks can be beneficial but can also be risky if the necessary precautions are not followed. According to the World Health Organization, masks are effective only if used in combination with frequent hand cleaning. Hand cleaning should be performed using alcohol-based hand rub or soap with water. Replace the mask with new one soon as it is damp, and don't reuse single-use masks. Clean hands thoroughly before putting and after removing the mask. There are different types of masks currently used by people, like homemade face mask, surgical masks and N95 respirator mask. Homemade face masks are good to wear in the places where social distancing is hard to maintain, but is recommended to be washed after every use. Surgical mask is preferred over homemade masks because it acts like filter. Also prevents the spread of the droplets from wearer to others. N95 respirator mask is a more tight-fitting face mask. It is designed to form tight seal to your face. In addition to splashes, sprays and large droplets, this respirator can also filter out 95% of very small particles including virus and bacteria.